Hello everyone, a very good day to all of you with another video with Dr. Mo, and today we are going to discuss something very important, which is the face eczema. Yes, there is one type of eczema that affecting the face. Actually, eczema can affect different parts of the body. Face is one of them. Face considered very sensitive, and we cannot simply use any medication over the face. So what is eczema? Eczema, it is a kind of an inflammatory condition affecting the skin, appears on early age, usually before the age of 5 years old. It could affect even the babies and the childhood up to the adulthood. Usually it will disappear or reduce, or it will become like a recurrent on and off. What are the symptoms of eczema? Eczema usually presented as a patch of redness, dry, itchy, more itchiness at the night time. It will cause some kind of what we call skin cracks, and that will be easily for the bacteria to come inside the cracks and cause the damage and more infection and inflammation. That infection and inflammation will cause thickening into the skin. So the eczema patch will be thickened. It's like a rough skin. So that's the very significant appearance of eczema. Itchy, dry, red. Okay? What are the things that aggravating or make it worse? First, environmental conditions, especially the things that make it worse, available in some kind of chemicals like the shampoo, like the soap, like some detergents, some perfumes. It will make it worse for sure. Second, the type of the clothes. If it is rough or made of wool, it will make it more worse. Third, animals, the hair, the animal's hairs, or the dust mites will make it worse. Some kind of food, especially the citrus food, they found there is some correlation between these type of foods or the dairy products and the appearance or the aggravating of the eczema. Okay. Second risk factor or aggravating factor is the temperature. If it is too heaty or too cold or too dry or too moist, will make it worse. Also, third, anxiety, stress, because it's related to the cortisol. When our body produces cortisol level high during the stress level, so that will make the eczema more worse. What are the things that related, and some people are more at risk of eczema? Number one, those who having a history of eczema, family history, they are more prone to have eczema as well. Second, those with autoimmune disease, yes, they will have an issue with the eczema, because eczema actually, if we talk about the pathophysiology, eczema is related somehow to the immune system. If our immune system is too strong, too high, and it will affect its own skin and affect the cells that produce, or the glands produce, the sebum, which is a coating layer, protective layer over our skin. It's like oily layer that we have it. So if this oily layer disappeared, not produce enough, easily the skin will be dry, cracked, infected, thickened, itch. Okay. Also, the other factor, those who are having kind of allergic rhinitis, seasonal allergy, or asthma, usually they have higher chance to get eczema. Okay, how to treat the eczema? There are non-medicational treatments and medicational and something natural. Non-medicational, we will advise the patient to drink plenty of water to rehydrate the body, use some kind of moisturizer, natural if possible and preferable, like the aloe vera natural. It will cause some kind of moisturizing. Third, avoid and try to avoid itching your skin, because the more you itch, the more you scratch, the more you scratch, the more you itch, and the more your skin will become thickened. Also, you could try to avoid the very heaty weather and too cold weather. Try to avoid the stress condition, because that will make it worse. Get enough rest and sleep to make your skin looks better. We move to the medicational treatment. Usually they will use steroids creams to reduce the flare-up of the eczema, but the steroids we don't advise and shouldn't be used for long time. You can consult your dermatologist and your family doctor as well. They will use also some kind of medication to reduce the immune, or tablets contain steroids or antihistamine. There are natural ways that we discover and we promote and we advise as a medical team, and this natural way of treatment is supported by evidence, clinical studies, and it is very proven for its efficiency. It is a kind of bacteria. We call it the Lactobacillus sakei probio 65. This bacteria is patented from South Korea. It is made from kimchi. This bacteria has the ability to balance the immune system because they found the eczema originally started due to some kind of allergy or some kind of immune imbalance, high immune system affecting its own cells. So that bacteria, good bacteria, will cause the immune system to be in a balanced condition. Second, this bacteria act as a natural antibiotics and a natural antimicrobial because it produces some kind of material and by itself act as an natural antibiotic, natural antimicrobial. Third, it is rich with vitamin C, which is good for the skin. And this probiotics is without side effect, doesn't need any steroids, doesn't need any antibiotics. Once a day, loaded with the 20 billion cells of the bacteria, 20 billion CFU, cell field unit, which is enough once a day to give you the nice results. After about 2 to 3 weeks, you will notice some changes. Also, it can be used, as I mentioned, as an orally, or you open it and spray or dissolve in water the powder and dip your patch of eczema. You will feel much better. It is all supported by evidence, by clinical studies, international and worldwide. For sure, you will need to use it for some time. Let's say within 2 to 3 months, you will have a fantastic recovery. As I mentioned, you will notice differences after 2 to 3 weeks, you will notice some changes and less redness, less itchiness, and less crack. Our advice to you to look for something natural, to read, study before you buy your steroids or anything else. And we wish you the best of health and to be safe as always. Take care. Thanks.